Welcome to my podcast. I'm going to talk about another common case can be presented in the clinical setting or the emergency. So basically, as we always indicate that you need to check the patient after you introduce yourself. You need to check the patient name and date of birth, and then ask the patient, "How can I help you today?" The patient will say, "Doctor, I waked up today with red painful eye. I'm not sure what happened, and apart from that, I'm in too much pain." And usually those kind of cases, because it's presenting with acute pain, they might present to the emergency. So our case here is a male in his 60s who presented with red painful eye, and he could describe the pain as deep, achy pain, and especially with the eye movement. It's so painful, and he can't read because that needs accommodation. So he's trained and it's painful, and also he had not tolerating any bright light. Apart from that, he's fit and well, and he has also hypertension, for which he's taking ramipril. So in that condition, you need to rule out a lot of things. You need to ask if there is history of trauma, if there is any medication the patient is taken. Obviously, in this condition is angiogen converting enzyme, that's ramipril. And if he has any history before, any medical problems like inflammatory bowel disease or ulcerative colitis or sarcoidosis, and also you'll ask if what sort of lifestyle does he do, and if he's working family-wise, and lifestyle, all of that sort of things. And then you will ask the patient, can I have a quick look for your eyes? So while you're examining, you notice that one eye is red, and the limbus of the cornea is erythematous. And you will just examine the pupil size, and one of them seems to be constricted, small. And the direct consequent light is responding, but obviously there is photophobia. And then you will do the fluorescein stain, and there's nothing you can be seen. There is no abrasion or any of that. So in that condition, you need to think about, as I say, one of the pupils apparently slightly constricted. In this condition, the most important cause is uveitis. So you need to think what might be the condition in this case and how it come up with this presentation. Sometimes it can't be, the reason can't be found, so it might be idiopathic. However, as I mentioned, it could be associated with certain inflammatory condition like sarcoidosis, like psoriasis, psoriatic arthritis, inflammatory bowel disease, and multiple sclerosis. And it has been found that HLA-B27 is positive in nearly 70%. Also, you need to rule out if there is an element of infection. So, for instance, if there is herpes, of course, we know how it's presented, the herpes, so herpes zoster. Herpes simplex. And herpes zoster, of course, it's completely different with its presentation. Also, cytomegalovirus, toxoplasma, and certain other infection like syphilis and tuberculosis. And it has been stated in such a situation in the pandemic, it was associated with COVID-19 and also post-COVID vaccination. And it has been found that certain drugs like the new biologic for psoriasis, some of the medication has been linked. And also there's this one called rifabutin and BRAF inhibitor, which is used for metastatic melanoma, has been linked as well. In this situation, you need to think, is it anterior or posterior? As we all know, mostly and commonest one is the anterior one, which presented with those symptoms I just mentioned. However, if it's posterior, it can be tricky because the situation in this condition, the symptom will be less specific and it's painless. The patient might notice certain floaters. And if the condition left like this without treatment, there's potential complication for synechia formation, buildup of the pressure inside the eye, glaucoma, and cataract as well. So after you explain all of that to the patient and what might be the reason for all of this presentation, you need to suggest for him the treatment. And the most common treatment presently is topical, basically steroid to help for inflammation, and also topical dilator in order to relax and dilate the pupil in order for the muscle around the eye, insular muscle, to be relaxed so the patient won't feel too much pain. And in certain situations when it's really resistant and it's not responding, of course, you need to think about other things, for instance, like systematic steroid. So by that, I just presented a case that you could see in the clinical setting or in the A&E about red painful eye and how you approach it, and it could present also in BLAB2 case station as well. Thank you.